I'm Jenny Trott, and this video is all about Bobath Therapy. I'm here with Philip Vervaeke, one of the clinical specialist physiotherapists here for Bobath Scotland, and we're going to be talking all about Bobath, what it is, who it's for, what you might expect from a therapy session. Stay tuned, and then we're going to find out all about it. Hi Philippe, thank you very much for joining me and finding a space in your therapy schedule. So we're going to be talking all about Bobath Therapy, and we're here in Scotland at Bobath Scotland. I think probably the first thing we need to do is talk about what Bobath Therapy is. So can you give me a quick idea of what it's all about?
Yeah, so Bobath Therapy is in the first instance, a family-centred approach. So it's important to find out from the family what their expectations are, particularly what their concerns are for their child or the person that we'll be working with, and help them achieve goals that are important to them, functional goals, in fact.
So how does it differ from any other therapy approach?
Yeah, so the difference is really it's a clinical reasoning approach. That's kind of the framework. It's a problem-solving approach. So with clinical reasoning being, it's about observing and analysing how the person is moving, and it's also about interaction between the therapist or the therapists, in some cases with the person, and actually also with anybody else that is in the session, which is usually or is always another parent or carer, and possibly also siblings, and then analysing how the person is moving and what that means for their overall functioning in daily life, and changing the way they move for it to be functional, but also more typical and more efficient, and helping them to use their own activity for that to stay. So it's not good enough to change things in the session and then for them to relapse to what happened before in the next session. So each session we're looking for progress, and to build on that progress in the follow-up session. And very important is that the person uses their own activity, reasoning being that cerebral palsy is a sensory motor disorder, and so we're relying on the person's feedback to actually be aware of, not necessarily consciously, ideally actually automatically, of changes that are happening to the body while we're working with them, so that with using their own activity, then they're slowly, gradually changing the way they're moving, and that is a change that stays over time.
Okay, so you mentioned cerebral palsy there, so it's important that we highlight that this is a therapy that's specifically designed for people who have a diagnosis of cerebral palsy. Is that right?
Yes, it's for people who have cerebral palsy, or what they would call allied neurological conditions. And particularly what we see, and what Mrs. Bobath identified, was that initially she was working with actually adults, people who'd had a stroke, and then she opened up the approach to also include people with cerebral palsy. Bobath Therapy can help everyone who's got altered tone to bring the tone that is either change to below typical or above typical, or a combination of this, or fluctuation of this, to bring the tone more towards the typical range.
Okay, so interesting that it started off for as a therapy for adults. I think it's mostly concentrated on children now, but do Bobath Scotland, you offer support to adults as well?
Yes, we in the last 6-7 years we've now included also therapy for adults. which is it's funded differently, but it's been a natural process that the children, some of the children that we were treating, grew up into adulthood.
Yes.
So they obviously wanted to come back because we already recognize that CP is a lifelong condition with, for a lot of people, near normal life expectations. So it's important that we keep on supporting.
I think we should touch on what to expect from a therapy session. But before I forget, it's not something that just you come to every week for a year. It's concentrated sessions, isn't it? Periods of sessions.
Yeah, one of the pieces of research that showed that intensive blocks are a very effective way of helping children with cerebral palsy. So we tend to work in blocks, in intensive therapy blocks. Children come here together with at least one of the parents, and it's a process of working together, communicating, interacting, as I explained earlier, and both the child and the parents, people who care for the child, learning together and growing, and actually almost spontaneously, naturally practicing the things that they've learned at home. And it's not practicing as in exercising, it's about incorporating it into their daily life. Often we will use opportunities as dressing to do it in a slightly different way, to change the way the child is moving, and also the way the parent is doing it, the way they're interacting together, and also particularly using play throughout their day.
Yeah, so play is quite an important part of the therapy sessions, isn't it? Is to make it fun and engaging and less like hard work.
Yes, because what I said earlier about we need to use the child's own activity in order to make the changes. So motivation of the child is very important, and also of the parents, in fact. So if we get the child on board, which is play is one strategy, but is a very very important and useful strategy, particularly the younger the child is, and having fun together as a family is an important aspect of anyone's life. But it means that learning will happen, and that we can achieve the changes that we're looking for.
I introduced you at the beginning as a physiotherapist, but there are lots of other therapy disciplines involved on the Bobath team.
Yes, yeah. So I'm only one part of our team in terms of discipline as a physio. So we also have occupational therapists. And the name says it. We're occupational therapists will look at the person's job or role in their life, which for children is very much about play, but also about learning, school, education, and also about leisure, which is very important. So all those aspects, and then we also work together with our speech and language therapist, which isn't just about speech and language, because that isn't always a given for people with cerebral palsy, but it's very much about communication as well as about eating and drinking. Again, not always a given that is easy from early on in life. Can be difficulty with feeding and with drinking and eating.
But important for people watching who maybe like doing fundraising. You are a charity, you're a registered charity, so a lot of your funding comes from fundraising, trusts, government support, etc. So important that everybody knows that too. Bobath isn't just here, it's elsewhere as well throughout the UK.
There's 2 other Bobath centres in the UK. There's the centre in London, the Bobath Centre, which is where it all originated from, the Bobath approach. And then there's also a centre in Cardiff in Wales. But Bobath happens in many countries all over the world.
Thank you very much, Philippe. That's been a fascinating, although a whistle-stop tour about what Bobath is. I think it's probably ticked all the boxes for those watching who don't know anything about the therapy, and hopefully enough to encourage people to seek it out if they think it might be helpful to them or their children. So thank you very much.
I hope it was helpful.
Thank you.